expeditious break. We're going to get started with our next plenary session. I have the privilege of introducing you our next moderator for this session, Ms. Chloe Jang, PhD candidate at Western University, fantastic communications advisor, and great supporter of SCAGO. Chloe's going to be the one moderating the session for us. So, Chloe, please take it away.
Delaney's a lot taller than me, so I'm bringing this back down. Well, thank you for the warm welcome, and we're really excited to kick off this session titled Capacity Building, Improving Self-Advocacy Skills to Access Financial and Other Supports. So we're actually going to start with introducing Riyad Elbard, who is going to be our first speaker. Riyad is the president of the Thalassemia Foundation of Canada and has been a leading member of the Thalassemia Foundation of Canada for over 25 years. He is dedicated to advocating for optimal care for all thalassemia and hemoglobinopathies patients. He represents the foundation on various committees and has been instrumental in building and maintaining strong collaborative networks with partners and stakeholders. Riyad, with a special interest and expertise in blood safety, represents the Thalassemia Foundation of Canada on the board of directors of the Thalassemia International Federation, where he has been serving in the position of the treasurer since 1998. He is also a solid rare disease activist and has been serving on the board of directors of the Canadian Organization for Rare Disorders since 2015, and on the board of directors for the Network for Rare Blood Disorders since the inception in 2004. A passionate and outspoken thalassemia patient, has acted as the patient's voice at forums and meetings, both at national and international levels. So we have a very esteemed speaker with us, someone that's very busy and very passionate. Thank you, and I welcome you, Riyad, to talk about your developing the self-advocacy skill sets that get results.
Thank you, Cleo. Thanks for the organizing committee for inviting me. Thank you all for being with us today, and we will get started. So hopefully we'll get into some discussions. We'll go through the slides. They're a little bit busy slides, but we will go through them fairly quickly, and then we'll have questions and answers. We're waiting on Sandra. She's a bit delayed, but she will be here with us shortly. So next slide, please. So self-advocacy is the ability to communicate your needs. If you want a very short definition, that'd be a very good one. People who self-advocate are more likely to thrive in school, work, and in life, pretty much in everything that they do. Self-advocacy can be learned at any age. You could learn it from when you're a teenager or when you're much older in life, and even at a very late stage in life, because you need these skills at times when you're not expecting that you need them. So self-advocacy creates independence and empowers people to find solutions to problems that others might not be aware. One of the things I learned through my journey in doing a lot of advocacy is you really have to present solutions. And that's what it is. That's what really makes a difference, not just identifying the problem or stating what the problem is. So again, this could be learned in small steps, starting with understanding your own challenges, or maybe just to say that there is something wrong and we need to do something about it. Next slide, please. So self-advocacy has three key elements: understanding your needs, knowing what kind of support might help, and communicating these needs to others. So it's really self-awareness and the ability to find solutions and support. It's very important to understand what your needs are, to be aware of what your limitations are, what your strengths are, and to work with that. And identifying the support that you need, so that would also help you. Then the most important is communicating, and communicating these needs to others, what will make the difference. Next slide, please. Also, it's important to have a growth mindset. What we need this for is it's something that will help you believe in learning skills that will improve your effort. So no matter what you know, you always have to be with an open mind that you will learn something new, you will have a different approach, and it helps you in a way to describe how you view the challenges and setbacks. You will meet setbacks, you will meet challenges. These challenges will be very complicated, and you have to have the ability to be willing that you're gonna change your mind, you're gonna grow, you're gonna learn more. At the beginning, when I started to do advocacy, or still even now, you see a lot of patients, what they do is they scream, they complain, they don't get anywhere, they get more frustrated. That's fine. I mean, you need to vent, you need to let it out, but that's not the way to do advocacy. That's just screaming. You really have to be part of the solution. So having a growth mindset has a big impact on how people approach challenges and build self-esteem. So having that self-esteem is very important. Next slide, please. Some of the areas or the aspects in life where we see advocacy, self-advocacy mostly, is education. We know students, how they self-advocate to work with their teachers and administration on how they take active role in their educational journey. The workplace, we might meet some harassment sometimes, or we need fair treatment. We might face some favoritism. And healthcare, of course, that's for people with chronic conditions or disabilities, especially those who have intellectual and developmental disabilities. So understanding your own medical needs and being able to effectively communicate them is key to receiving appropriate care. Legal rights, you have to know your rights, and knowing how to advocate for your rights and how to make sure that you are not being treated different, especially when dealing with law enforcement and or any navigating legal process. Personal relationships as well. Self-advocacy is equally crucial in personal relationships, whether it's with your family, your parents, your friends, your colleagues, or your partners, whatever it may be. So next slide, please. Why is self-advocacy important? It's not something that you acquire. It's a pivotal aspect of personal development and empowerment. It's something that will give you a specific set of skills where you feel you're empowered to make change. The ability to advocate for yourself will enrich your life in various ways, and especially giving you control that extends beyond survival. You don't just want to survive, you want to thrive if you have a medical condition. And being a proficient self-advocate will allow you to make informed choices, and that's very key, because we all have choices and we all have to advocate to have choices and then make informed decisions on which choice to go with, and we have to have necessary tools to gain a clear understanding of your options in any given situation. Enhanced self-esteem. Self-esteem is very important because this is what allows you to gain confidence. This is what allows you to stand up for yourself, and more to allow personality strengths as well. So engage in meaningful communication. Understanding the importance of dialogue is a cornerstone of self-advocacy. It's really communicating those needs and how you're going to, why do you need those needs, and what is going on with that situation that you need those needs for. Next slide, please. So some strategies for self-advocacy is self-awareness, which I mentioned earlier. Knowing your strengths, your weaknesses, values, and goals is crucial. Also, it's understanding yourself keeps you informed on what to advocate for. Research and knowledge. It's important to know what you want, to educate yourself. For example, if you're a patient, educate yourself on your disease, on your own specific condition, what works for you, what does not work for you, and anything that will affect that. Knowledge empowers you to make a strong case, and that's why it's important to go prepared and to have that knowledge when you're advocating. Again, clear communication, so you need strong communication skills. That's very important. You have to articulate, you have to listen actively, and you have to be assertive and concise speech to ensure your message is well understood. And building relationships, I always believe in building networks because you do need that collective support to achieve whatever you want in terms of advocacy, whether if it's for individual or if it's for a group of patients or a patient organization. Next slide, please. So again, continuing with strategies for self-advocacy. Strategic planning, this is very important. It's to be prepared. You have to have a plan. You have to have something in place where it's a process. You're gonna do this is number one, this is number two, this is number three. Set clear, achievable goals and develop step-by-step approach. How you're gonna do them, what you're gonna do, when, and anticipate some challenges and some setbacks and how you're gonna deal with that. It's very important to be prepared, especially, for example, if you have a meeting with key decision makers at a hospital or Ministry of Health or anyone that, even your doctor, because you have a very small time frame that you have to do all the work that you've been doing, you have to kind of focus it in half an hour, and 5 minutes usually go on greetings and hello until you sit down. And then the next, you're gonna explain, give them some background, and then you have like about 5 minutes to really state what the concern is, and then see what is it that you want and how you're gonna get that. Documenting and evidence, again, that's part of being prepared and part of having something on record, like on such and such date I talked to this person, you know, I was promised this, whatever it may be, because you need to keep back up and to even if it's an achievement, acknowledge that. And even if they've given you something, like if it's the government has issued you something or the hospital has done something to help you as a patient, then recognize, acknowledge it. And then incidents that can, you know, report on incidents to provide concrete evidence. Persistence and patience, and that's also very important because self-advocacy requires perseverance. Change doesn't happen overnight, and it takes time, hopefully not too long, but sometimes it does. And outcomes are not gonna be immediate, and there are setbacks. Sometimes you go and nothing happens. You work hard on advocating for like few months or even longer, and then you go back and there's nothing changes, or you just get a flat no, and what do? Go home and cry? Well, maybe, but you need to start again and set your wheels in motion. And feedback and adjustments, that's very important. We often neglect to do that because you need to know how well you did on one thing, or what are the areas you can improve, and what are the things you really need to change. Next slide, please. This is just some suggestions for patients to do self-advocacy is learn about your disease and understand your unique condition and how it impacts your quality of life in health and in short term and the long term. You need to know how it's affecting you. Determine your needs to thrive, not just to survive. Rally support from your family, colleagues, community, whoever may help you. Partner with your healthcare team to actively engage on decisions affecting your medical treatment and overall health. Your healthcare provider should be your partner. You should see them as your partners, and you should work with them as your partners. Sometimes that's difficult, but something we have to work with. We have to try and do as much as we can. Some healthcare providers are really awesome. We've been blessed. We have a lot of great doctors. Seek resources through your social worker, transition navigator, and all other support networks available. There's something I learned about not too long ago, which is called systems navigator, and that's someone that helps you navigate whatever system you might be, because we don't only have one system in Canada the way things are. It's many systems and many layers, so that you have to have someone who has more knowledge or some expertise in that area. Share your experiences and knowledge with other patients. I think that is very key, because you do want to share that knowledge to benefit others, and maybe you can learn from others as well. And ask for support from patient support organizations, and perhaps take the lead on advocacy initiatives affecting you and fellow patients or your community. You have organizations like SCAGO and the people who are making SCAGO a reality as a great resource. So this is the people you can always count on and the organization you can count on. Next slide, please. So the importance of patient association advocacy, I'm gonna talk just very briefly on this because just to touch on that. So it's well understood that there are significant differences in the delivery of health care throughout the world. However, there is one constant, and that's the patient. So it's always the patient that's at the center. Wherever you look at the situation in the world, things are different, whatever, but there's always a patient at the middle of it. And patients' needs vary greatly based on socioeconomic, geographic issues, expected prognosis, family dynamics, health literacy, and many other factors. In the past 2 to 3 decades, the role of patient advocacy organization has added an important new dynamic to patient care. It has become an important part of patient care. Next slide, please. The benefits of advocacy efforts for patient organizations, as we heard in the presentations just earlier this morning, it's beneficial to researchers and to patients as well. And I would add it's also beneficial to clinicians on accessing support and accessing services and accessing better care for the patients. Closer collaboration and partnership with physician and physician organization, hospitals, and health authorities in order to improve individual patient care and the quality of care that physicians can deliver. For example, if you want to develop standards of care or guidelines or whatever it may be, you need collaboration, and that's where the advocacy part will come in as well into enforcing or applying those guidelines and those standards, which you need partnerships with all stakeholders actually, but the physicians usually are the ones you want to work with the most. And again, you work with them, with the physicians and the patient advocacy groups towards common goals to measure the impact of advocacy and increase community-based participatory research, which we heard about this morning. I'm gonna skip that. Next slide. Let's skip the next 2 slides. Yes. No, the one before. Yeah. So suggestions for enhancing self-advocacy skills. Interactive workshops. These are things that I believe Scarborough is doing, some of it, if not all of it. Interactive workshops, organizations can host interactive sessions that cover the 3 key elements of effective self-advocacy, which is communication, self-awareness, and problem solving. Incorporate into educational tools, develop online courses on self-advocacy using real-world examples to make the concepts relatable. Resource kits offer informational pamphlets or online resources that cover the basics of self-advocacy, including laws that may apply and strategies for effective communication. And mentorship programs. Pair up young individuals with experienced self-advocacy who can guide them through the nuances of effectively advocating for oneself. The young lady yesterday, Fitzanne, she's amazing. Listening to her and what she presented was excellent, and I think she would make a very excellent mentor and role model. So things like that, and these are things that are happening. It's just we need to do a lot more of them to move forward on learning and enhancing our skills for self-advocacy. Thank you very much. Thanks for your patience, and Sandra is here so we can proceed.
Thank you very much, Riyad, for a very insightful session. Next up, I have the privilege to bring up to the stage Dr. Sandra Newton, I'll speak slowly so you have a moment to catch your breath. Dr. Newton is an experienced clinician with training in developmental, clinical, and social psychology with an MA and PhD from the University of Toronto, as well as a long-standing interest in advocacy, education, and support for children, youth, and adults with sickle cell disease. At SCAGO, Dr. Newton facilitates workshops and peer support group sessions to support research initiatives, such as the vaccination acceptance within sickle cell disease / Black community study, which was funded by the Public Health Agency of Canada, and provides supportive counseling to clients. Please help me welcome Dr. Sandra Newton.
Hey, good morning, everyone. It's not morning anymore. That was wishful thinking. Anyway, I'm glad to be able to join you. And Riyad, what I caught of your presentation was, as usual, on point. And I really appreciate the way you have used your own personal story to inspire others to fight for what they want, you know? And I think that financial support and even seeking that, applying for that is a form of self-advocacy. I think people don't often think of it that way, but you're saying, I have a need, I have a desire for it to be met, and I want to know what resources are out there that I may be able to access. And what I hope to do in my part is not share lived experience so much as my own rambling and roaming on the internet, in consultation with others who do a lot of this support finding for folks with sickle cell as well, to share what I've found. I just want to give a bit of an overview in the time we have, and maybe Chloe can be my time alerter, or Riyad, you can just... All right, thank you. Hopefully I'll figure out how to, okay, great. So you'll just see a bit of a summary slide that I'm using to work through, but I thought it would be most helpful to think about financial supports in kind of broader categories, right? Some are grants, meaning things that you aren't expected to repay. I don't cover things like loan products here, but I know that some people have sought financial supports for that reason. And there are outlets, again, not within the scope of what I'll share, but grants are usually money provided to you to reduce your expenses, cover them entirely, to meet a need or a gap in your resources and your need, right? And some of those are partial, meaning they'll give you a percentage of what you need or reimburse you, and some are full. So they may be almost like a pension amount in case of developmental services, which I'll talk about as part of what I cover. And they're meant to look at your daily living needs, right? Your personal care needs. Some people need not just medication, but equipment, breathing apparatus. Some need to make adjustments to their homes because maybe they've had a physical outcome of sickle cell that now affects mobility and the ability to use their physical space. Importantly, respite funding pops up often, and respite is about literally giving people a break, usually caregivers, not, sort of a vacation from care of their dependent person in their family, but more just understanding that they also have needs, and that pause, that time apart with somebody who can support their young person or dependent works for both, right? So that will be covered in some of what I share. I know that I was asked to look at chronic illness as a financial support endpoint. And I guess what I found challenging, certainly around government and funding and things like that, is that chronic illness itself isn't always a grounds for provincial or federal funding. Maybe you've noticed that yourself. It's much more the degree of disability. And I know that that points to some ableism perhaps, but I think it also helps governments and funders with their decision making when you have a lot of need and limited resource. You want to identify people most in need and least connected to support to meet their needs. So really, when I speak about chronic illness and disability, they're not actually interchangeable, although they travel together a lot. As it mentions, chronic illness is something present over the course of your lifetime. It's of long duration, it's recurrent. Asthma is a form of chronic illness, for example, but not necessarily a disability. And again, that idea of disability suggests limitation or impairment. In fact, requires it for eligibility in most cases, which is tough to hear when we are very much in the spirit of wanting to talk about what people can do, to adapt environments to what people need rather than to say, you're not a fit for what is needed. So, but again, this is the language you'll see throughout. Disability is really referring to that physical or mental or both combined impact on aspects of your functioning or your broad functioning. So maybe it's just one piece, or maybe it's your day-to-day functioning in full. One thing you'll notice as a pattern, whether you've applied for or received funding before or about to do that, is that there are a lot of criteria. These are the must-haves, right? So usually, if you might imagine, if you were saying that you have a need financially to meet concerns that are related to disability, you have to show that you have a diagnosis. You have to show that through paperwork, reports, sort of self-identification isn't usually sufficient for these. Age can be important. I have a couple of slides, and one of them is geared more to the developmental period, so children, teens, people not yet 18. The disease severity or impact is important as well, because you may have a lot of needs but not experience a lot of disability, meaning that your ability to engage with your day-to-day tasks and things that you want to do is not markedly impaired. And then some will also speak to not just your physical or mobility needs, but cognitive ones. We know that as a group, folks with sickle cell are a very diverse group. Some folks have really struggled around neurological risk. Others have impairments. They've had maybe strokes when they were young. Some need surgeries to look at challenges with the hip joint and other joints. So there's a lot of different ways it can show up, and so I would want you to know that maybe the person to the left or right of you applying may or may not have success, but that does not communicate what yours or predict what yours will be. Each person needs to try, and again, that sense of self-advocacy being important. Find out, what you're eligible for. I mentioned that there's usually a need for supporting documentation, but the application itself doesn't need to be initiated or started by your provider. You can start it often, but it can be so daunting that one of the things that I'll touch upon is who the helpers can be. I mentioned that assessments are happening. So I, being from a psychological background, will read a lot of psychological assessments that have been completed in school or through a hospital like Sick Kids or Toronto General or any of the major health centers where someone may have been assessed around learning or ability to work or things like that based on a functional need. Financial statements can be important because, again, we're demonstrating needs. So something you'll hear again as I go through is the need to have that documentation, anticipate that things like tax returns, if you are a caregiver, or earning statements, or what have you, will be needed, right? At least copies of them to demonstrate that you are eligible and someone who needs the support. Just another note or two to say that sometimes funding is one time, and you need to reapply for it, or it's only granted once. And in other cases, it's renewable, provided you continue to have that need level. So you might imagine if this is something that you're going to recover from or have less impairment in over time, you may or may not be eligible for that same grant again. So something to keep in mind. Yeah, and I noted yesterday, I had the pleasure of presenting with Sarah Rashid, social worker from McMaster Children's, and she did remind folks that things like employment insurance and insurance products they may have around disability could be things they could access for financial support in times of need. And I know that won't apply to everyone, but I don't want folks to discount that as a potential source of support. So, onto a slide that I don't expect you to read word for word, I promise. I'll see if there's a way to share it with the links. But the main, remember I told you I would try to sort of divide things into sort of an adult group and then something for more developmental needs or younger people. It's kind of roughly so, but in red here, this table is really about some of the things that those 18 plus can apply for. I'll just go through them. I won't, belabor with every detail. And you'll see when I speak about amount that it varies. Why is that? That's because your resources and what you demonstrate your need to be tends to be the decider in terms of how much funding you get. Sometimes it's a set amount for everyone, but not always. Something that comes up often in conversations with folks with sickle cell disease that are in adulthood or on their way there is Ontario Disability Support Program, and others, maybe people in this room have it. I'm actually hoping, if Riyad agrees and Chloe agrees, that we will have some time to talk about your own application experiences and some of the sources of funding that you've found particularly helpful. I think it will really inform others, and it'll help us identify some of the barriers that we need to push to change. So the disability support program is something, again, where someone needs to demonstrate that disability. And I mentioned that chronic nature, recurrent, cumulative. So over time, there's been an impact. And importantly, it's limiting someone's ability to engage in earning at the level that they would without those things present. And I mentioned that assets, so things that you already have, are counted in to see, what your need is. And as you might imagine, these programs never seem funded fully enough. There are always gaps for folks, so sometimes they're drawing from more than one thing. And as came up yesterday, if you were here, we talked about the fact that having more than one source can sometimes limit all of them, because again, there's this sort of cap, and the fairness of that, it doesn't even need to be debated. I think we know it just never feels like enough for folks. I mentioned below that the Ontario Works program, and within Ontario Works, which is for folks 16 and older with financial need and not having sort of assets or other sources of funding to support them, there are drug benefits, and turns out as well, benefits for dependent family members. So if you're able to secure that and go through some of their work-related requirements, often they're able, for a lower-income family, to provide funding for, say, children in that family. But the actual applicant needs to be an adult. I did note that you can get up to $733 per month for that, but again, can't estimate that without knowing more about specifics. Tax credits, and I'll mention this again on the next slide, tax credits are a little different. They're not sort of money given to you up front that you use to spend on approved things. Tax credits are refunding you for expenses you've incurred as part of your health condition and the disability as it's been defined. And I mentioned here, again, this wording around severity, prolonged impairment, and that it can actually cover a number of sensory areas. It's not just walking, but people have vision interruption, hearing impairment, right? Like there are all kinds of things that could go into that. There are maximal amounts for adults, and you'll notice that for children, there's almost a supplement on top of that because of some of the intensity of services needed in the developmental period. That's where we actually have most of our opportunity, right? When kids are young, we try to get a lot of therapies and other things in, and the costs are significant for families. EI, or employment insurance sickness benefits, what a word, but that's the official wording. These are connected to employment insurance and the number of hours one's accumulated earnings-wise, right? So that requires then to have had some time in the workplace, put in a critical number of hours, and then to be able to receive that. A test for this one in terms of eligibility is a real decrement or decrease in the amount of earnings you have or could be receiving because of interference of health concerns. So it's based on insurable earnings, as you'll see, and not 100%, but just over half. So again, people experience these gaps that are very frustrating and can feel limiting. The Trillium drug program is, I think, mentioned toward the bottom of my slide and yours too. These are about prescription costs, and these are about costs for prescriptions that are not covered through other means. And it requires, it's almost like a bit of a deductible. If you drive or if you have a product like that, there's an amount that you pay and there's an amount that's covered by your insurer, and that's how Trillium works as well. Folks that are not receiving this kind of support around their medications from other sources, like that Ontario Works program further up, may be eligible for that. And again, it's about, and actually I wanted to mention also in relation to disability tax credit, if you are a caregiver who is seeking this on behalf of your young person or your dependent family member, there's a transferable aspect, which is great, right? Because perhaps your child isn't filing taxes but needs them. Thank you, Chloe, for that. Moving on just to this other slide, and again, I haven't really divided things into adults, children here, but the orange slide's a little different because it does have more things pertaining to children and youth. Developmental Services Ontario is one that I wanted to mention just because very few, I think, know about it in a timely way to facilitate applying so that as soon as someone's 18, we're good to go. You can start applying for developmental services funding by 16. It differs from some of the others because it's more reliant on tests of cognitive or intellectual functioning. So when I see folks receiving Developmental Services Ontario funding, which can be substantial, almost like a life pension in place of being able to earn, paying for like an adult caretaking and other things like that, I do see that that value is high. There is quite a process involved, and all available at DSO Ontario. And this is one of those great programs, though, that provides some tutoring, so to speak, some coaching online, and an assigned person to help you. Ontario Autism Program is another one I mentioned. Listen, there are intersections within sickle cell, right? We've got folks on the autism spectrum. We've got folks with intellectual disabilities. They're all manner. There's diversity in the group. And so just having awareness of this, I hope, will be helpful. Many of our families may have applied for things like special services at home. I'll call your attention to that, which is third on the list, as well as ACSD, or Assistance for Children with Severe Disabilities. Again, very child-focused, looking at the costs of caregiving, therapies, and other things. I wanted to mention as well, just at the very bottom there, things like technology are important for some people to be able to do what they need to do day in and day out, as are those physical changes to their home. And just wanted to make you aware that those things are out there. Sometimes they require special application through taxes and what have you. And before Chloe gets me, I'm just going to say a few more things. Students, I don't want to miss out on mentioning that those that are pursuing post-secondary who have sickle cell disease can look for support from a number of sources. I've really covered government here because, as you can imagine, the private and foundation-driven awards are numerous, hard to capture in a few minutes. But I do want folks to know that if they can show that need, learning disability diagnosis in particular, there's an ability through the Ontario Student Assistance Program, or OSAP, to apply for certain grants for equipment, technology, and so on. March of Dimes is one of those private organizations that has a number of things for kids with and adults with co-occurring needs around the physical concerns. And then I didn't want to miss SCAGO there. I know that we have a well thought about respite emergency and transportation support program, which is really about funding the individual's needs, but we didn't want to forget that caregivers also have those supports. So this pays for someone to provide support to your young person so that as a caregiver you have that break. And these are things that we look at annually. We ask that people that are applying understand that those are one time, at least within that calendar year, and contingent on resources. But I do encourage people to apply. That's all on our website under support. I'll move through this next part very quickly. The red words really highlight what I want to say. The need for documentation and to have a portfolio together and to really be diligent about that. Seek help with getting that paperwork and documentation. Keeping deadlines in mind. I've mentioned for those that are for children and youth that timing is important. You can age out of eligibility for some of these things when you hit 18, for example, but preparation can start before. I want people to know as well that appeals are possible if you feel that for some reason you should have been awarded that grant or amount, and to find out more about what would increase eligibility, and that there are a number of resource people around. I mentioned SCAGO, myself, physicians, nurses, our social work workers especially, people that will prepare documentation for you and also help you to complete it. And reconciliation, keeping what we spend receipt-wise so that we can show how it's been used. So I do hope that's been helpful, and I hope that if you have questions about it that you'll ask, we'll do our best to respond. Thank you.
Thank you very much, Dr. Newton. It was evident that a lot of research has been put in to put this resource together. I would like to open up the floor to questions. I see Tanya has a question.
Thank you, Riyad, and thank you, Dr. Newton, for such an amazing presentations. Quick questions, Dr. Newton. So one thing is we do know that sickle cell disease affects people differently. For some, it's a disability. It's very evident, and it qualifies for every definition of what a disability stands for, at least the current definition that we have for disability. And for some, it doesn't really affect their day-to-day. So I think it's been a gray area whereby some people feel that there should be just a blanket coverage, that if you have sickle cell, it should be said that you have a disability. And some felt that they do not want to be put in that category because they don't feel that sickle cell is a disability to them. They do have sickle cell disease. So we've had different conversations and different thoughts from different individuals. You know, in your opinion, being a psychologist, you have spoken to and supported quite a good number of families with sickle cell disease. What is your take on this? So that's number one. Number two, I also just want to mention that in addition to all of the amazing scholarship list that is there, SCEGO also provide the Sunday Afolabi scholarship every year. And so just for folks to know, if you're seeking post-secondary institution, you can apply. And yeah, our qualification is you have sickle cell disease, you'll qualify. Thank you.
On? Yeah? Okay, thank you. And Ms. Unray, thank you. Please accept my apology. I'm looking over at you, and I know that Sunday Afolabi Scholarship was, of course, inspired by your loved one. I'm so glad that you highlighted it, though. It is something that's available, but people need to apply. There is information on our website about it. It's a little bit better? Okay. So thank you for that, and I can always update this to reflect that more accurately. But you make a great point. Sometimes I think... I know that disability is something that should be self-defined, right? And unfortunately, depending on your context or setting, you can look more or differently abled at different points. And I think that that's a challenge for folks. In order to be eligible for a lot of these things, you have to describe yourself as wanting in terms of skills or abilities or at adaptive wherewithal, and it seems so unfair because it is. I also want to mention, though, that it's also about when you look at someone. So if I'm at a point in my life where I'm functioning well, I'm making the connections I need to, doing what I need to do, I don't feel a lot of interference, I prefer that word, actually, in what I need to do. I may not define myself as somebody that needs this support, but at another point in my life, I might. Okay, well, that was bound to happen. Sorry, thank you, Riyad. That poor phone. Well, we'll pray for it later. But I do think that you bring up something important. It's unfortunate that we have to sort of put people into a box that fits for us in order to make decisions like this, when in fact the abilities, the things we can do, the hope we should have, a very strengths-based lens is far more appropriate. So I think self-definition is important, and understanding that when resources are scarce, there needs to be a way to identify who needs what most. So I hope that folks will not feel limited. They will say, that could be me, and try. And then think about their needs across the lifespan. They may change. And apply for the Sunday Afolabi Scholarship.
Is there any question from the audience? Because I do have a question that's gonna, okay. I would like to ask a question, actually, maybe Landry or Sandra can help us. Is, when Sandra was mentioning ODSP, Ontario Disability Support Program, I was nodding because I know that's an area where a lot of people have difficulties getting. And I have a friend who's a paralegal, and he's always fighting on behalf of patients and other who are non-patients, but they have other conditions. So does SCAGO help in that process? Is there something you considered about maybe supporting people who apply for ODSP, not financially, but actually through their application?
Yeah. Do you know, I think that you make a great point. For something so important for people's sustenance and getting through life, when they come to that decision, first of all, even to apply for it, which I know is a hard decision for people, then to have it denied is really challenging. I have found that folks have done well by learning from what others have done. I have not personally, for example, written a letter or anything like that with an application. I've done a lot of routing of people to people that can help. I know that the program administrators offer some support. I also know that via that red blood cells disorder, red blood cell clinic rather, website that was shared yesterday and can be again, there's quite a bit of narrative about that and strategies. So I actually find social workers in hospital settings have been doing a lot of thinking about this. My typical move is to say, connect, say, with Sindhu Srikantan in the UHN, because she has been through those battles and has done quite a lot of sharing on the website. But let's see what Ms. Landry has to say.
Thank you, Riyad, for that question, and thank you, Dr. Newton. Just in line with what Dr. Newton said, most of the time, for our patients, whether they're pediatric or they're adult, we recommend that they work with their clinician. And you find that the doctors are very good in supporting them, and also the social workers are also very good in supporting them in getting that letter done. As a matter of fact, for those that maybe their children qualify, and you can definitely see for disability, you find that the doctors most of the time we actually initiate the conversation to say, we think you need to apply for this, and so on and so forth. So. And this is why, because we know through their doctors and all of that, they've been getting support, and then the social workers. And now we have Jess. Jess, everybody. That's Jess from London. She's our patient well-being coordinator for the Southwestern region. Jess will also be able to navigate people and direct them to appropriate resources to support them in those kind of applications and stuff like that. Thank you.
Thank you. Any last question from the audience? They're telepathic. All right, then if not, then I'll ask one very quick question. I think from the feedback that we got from yesterday was that real world examples are really like life lessons, and we can learn a lot from that. So I'm wondering whether or not either can you share an example of a time when you use self-advocacy effectively, or if you've seen a patient or advocate use self-advocacy effectively to help navigate whether it's like a health outcome or a systems question. I was wondering if either of you would want to go first.
I've seen many examples. One of the ones that always comes to mind was this young lady. She was at the transitioning stage. She was transferring from Sick Kids over to UHN, and that was back in the early 2000s, and there wasn't even an adult program. But she was sent from Sick Kids because she had some complications, and I think sometimes they want to send the ones that has complications first. So she came over to UHN, and the program wasn't even established. And she went through a lot of difficult times because she was like having to deal with cardiology issues, thalassemia, diabetes, And she was at that point in life when she was like, in her late high school, where it's important to be in school. And she lived out in the east, in Pickering, I believe, and she was coming to Toronto, like downtown, about 3 times a week, her and her mom. So that was a lot. And this young lady, she went through a lot of hard times for about a couple of years, like 3-4 years. But then after that, she has learned how to advocate for herself, and she has even built strength. And she went to university, and she graduated, and she did her master's in public health, and now she's doing her PhD, and she's become an expert in that area. And her example always comes to mind because the situation she went through and how she changed things around. And now the doctors call on her to be as a patient representative sometimes. She's a patient partner at UHN and at many other institutions, and she's becoming more or less an academic in that area. So to me, that's something that is very remarkable. Personally, I don't know. I just learned how to speak up from when I was young, and I knew how to articulate things. I'm sure I ruffled feathers sometimes, and doctors weren't too happy, and nurses weren't too happy. But you learn this because you live with a chronic condition. You have to learn how to fend for yourself, whether it be at school, work, or even at the hospital a lot of the time. And finances, yes, you struggle. You go through university, you need money, you need to pay for things. So sometimes you apply for the OSAP, you try to get the grants. And I know some institutions, academic institutions have emergency bursaries as well and that. So there are a lot of other areas to advocate for or to ask for. A lot of examples on it. I can't don't know where to start from. So.
Do we have time for more, or should we end on that very positive note? Would you prefer? Okay.
Thank you very much. I think her story is a story of resilience, and we learn a lot. We learn a lot from everyday examples, right? There are people living with it day in, day out, and then lots to take away from that. So I thank everybody for joining our conversation today. Again, if you haven't had the opportunity to scan the QR code and evaluate this session, we would really, really appreciate it. I think according to the next part of our schedule, it is lunch. So, lunch. As you may have been acquainted, there's food outside. There should be another round of delicious food waiting for you. So I welcome you to go take some bio break, food, and we'll coming back at 1:30. Sorry, I don't have it in front of me. 1:10? All right, so we'll rally folks at 1 o'clock and we'll start sharp at 1:10. All right, thank you very much.